Food insecurity and mental health demand have exponentially increased during the pandemic. We're getting updates on the situation now and what the future may bring as we head into recovery. That's this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat and additional supporting sponsors.
Demand for and access to appropriate mental health care and food have been challenges well before COVID-19. But since the pandemic, experts say that nearly 1 in 5 in the Las Vegas Valley is food insecure, and the demand for some mental health care provisions has nearly doubled. As we move into recovery, experts also tell us this demand will only increase. On today's Nevada Week, we'll discuss the state of food insecurity and mental health, and we'll also explore what kinds of policy and interventions we need to employ to weather a potentially very long recovery period. But first, we sit down with Larry Scott, Chief Operating Officer of 3 Square. Well, Larry Scott from 3 Square, Chief Operating Officer, thank you for being on Nevada Week again. We really appreciate it. As we just said before we started recording here, we had you on in March at the beginning of the shutdown. It's really great to have you back. And I just kind of wanted to start with where you guys are at, where 3 Square is at, and some of the numbers I'm seeing here. Estimates of 450,000 that are food insecure. I mean, if we're talking about just the population of Southern Nevada, that's about 1 in 5. The SNAP program is 48% up in applications, a huge demand there. I just want to know, for 3 Square itself, how you doing? Are you anywhere near the limit of provision or services that you can provide this community?
Yeah, certainly everything that we do, we have to evaluate our resources, whether they're financial resources, physical resources, transportation, volunteer resources, a variety of different things that make it all work. And so every time we assess a new opportunity or a new program, we have to try to look at each one of those resources and say, do we have enough? Sometimes, like today, our freezer is jam-packed. We simply do not have any more room to put more food in the freezer. So that impacts decisioning for that particular day or for the short term.
Well, that's great news, and that leads me really to my next question, is something we talked about on the last time we had you on, which is demand of provisions and kind of where food was at the time. And you mentioned that where you were getting food was changing and you were having to transition more to purchasing of food. Is that still the case, and is there still a high demand because there isn't supply right now?
Yeah, I think the last time we spoke, we were anticipating that we would have to be purchasing a tremendous amount of food, a much, much higher percentage. As it happened, federal programs, the CARES Act, was generous with the needy community and the farmers and has been purchasing and processing and distributing millions of pounds of food out to the communities of which we've been a benefactor. So federal commodities, as of last month, represented almost 45% of the food that we sourced. So that actually filled that gap for the time being with those federal commodities.
And those federal commodities, you talked about that on the last show too, and you were hoping, I remember you saying, I hope there's more relief. There should be more relief coming through. It sounds like that's happened. Compared to kind of a normal work month of 3 Square, I mean, is that a high amount of federal commodities? I know you're typically getting your food through other ways, so that shifted quite a bit, it sounds like.
Yeah, that was a dramatic shift. Yeah, no, federal commodities, if you went back 2 years ago, might represent less than 5% of the food that we would be distributing. So a combination of the CARES Act and what is referred to as trade mitigation, which is we're a benefactor of food that the federal government is purchasing from farmers because of trade issues with China. So anyway, those have ramped up. So yeah, if you compare it of 5% of our food to 45%, you can see it's very impactful.
Now you mentioned CARES Act, of course, in the news, might not be the food provision side of this, but a lot of the CARES Act funding is coming to expiration. But I know some of the food insecurity is following suit there too, and some of those provisions, and I believe Farms to Families is one of those that will end in October. Is that correct?
Yeah. The funding of it, the program, I think, actually was scheduled throughout the balance of the year, but funding of it is certainly going to run out. We're waiting for phase 3 to actually be initiated Thursday morning. It'll start for phase 3 of the CARES Act and the farm to family food boxes. So, but that'll only last for a matter of a few weeks before funding runs out on that. So that will come to an end, unfortunately.
And what does that mean to an organization like Three Square? You're talking about 45% of the food that you are getting is through some of this federal relief. Where does that put you in a couple weeks?
Yeah, we're not going to lose 45% of our food, but we'll certainly lose a fairly sizable percentage of those commodities out of that. And so we've been planning for it. We're keenly aware of the fact that the audience of needy people has expanded so dramatically. I will say that a likely scenario is that we will have to reach out to the public to assist us in helping to fund purchasing food more frequently. So what was expected perhaps maybe in April, May, might be pushed out right towards the end of the year and on into 2021. But there does not seem to be any real decline in the number of food insecure people. So we're in this for the long haul.
Yeah, that's a great point. And if history tells us anything, let's go back to the recession. Of course, food insecurity maybe never recovered. And we saw at least a huge demand years and years and years after the actual hit that we had. Really, really important. On the limit side, we're talking about food provision, but of course you need volunteers, you need staff members, you need the warehousing spaces you mentioned to be able to do this too. First off, I want to make sure this statistic is correct. 5.6 million pounds of food that is delivered per month. Is that correct?
That's the current pace. Yes. That is the level that we're at now through the pandemic thus far. And that wasn't historical. You could probably bring that down to 1 million pounds off of that. But yes, during the pandemic and with the availability of the federal commodities, that's the level that we're distributing right now.
Let's talk a little bit about who you are serving and maybe how that's changing a little bit. When we talked in March, I mean, it was the demand was higher. You mentioned seniors as a major concern at that point. Are there specific populations you're seeing through your service that are the most in need?
You know, the one that I think we're all the most sensitive about here at Three Square are children. And only because the kids are not in school. We historically would be delivering as many as 18,000 meals on a given day to schools, public schools, charter schools. And today we're only delivering about 3,000 to 4,000 meals to recreational centers where children are congregating. And so that concerns us. We hope that we've made up for it with our emergency distribution sites and being able to provide a volume of food to families. But that's the segment of our community that we have always reached very well that we're worried about.
Yeah. You look at the school model, and of course we're in distance education right now. There has been talk, and as we see numbers maybe improve, we could go to a hybrid model. If we were to do that, and so you had children in school a couple days a week, will that significantly improve the services and the direct contact you have with children?
CCSD would certainly have to make the after-school programs available to us. If they did after-school programs, then yes, we would be able to deliver meals to those schools and provide those meals, and we absolutely will do that. I will say this, that CCSD has done everything I think that they can to be able to feed the children, and I admire their efforts. So when we analyze how we are going to take care of the children, we are certainly taking into account what they're doing and try to fill the gap that is missed for the children.
Well, thank you so much, Larry, for joining us. Now we turn the conversation to mental and behavioral health. Please welcome Dr. Stephanie Woodard, Department of Health and Human Services Senior Advisor on Behavioral Health, and Jamie Davidson, Psychologist and Associate Vice President for Wellness at UNLV. Well, Dr. Stephanie Woodard, Jamie Davidson, thank you so much for joining us. We really appreciate it. Really appreciate your time. And I wanted to go right into it, and let's just talk about where we are with COVID. There is optimism here. We're seeing test positivity rates kind of go down. There's talk of a vaccine. Even unemployment rates are starting to show some improvements there. But let's talk about mental health, and let's talk about the demand on the mental health system here and what you are seeing. Are we seeing any downward trend in the need and the demand for mental health, or is it going the opposite direction? And let's start with you, Dr. Woodard.
So right now we're actually seeing quite a few people reaching out for help, and that was something that we would have expected. About this time in any disaster, what we're seeing is people who have been able to really hold on and cope and manage up until now have been able to do so. But for people who have been experiencing high levels of stress, including things like job loss, changes in their day-to-day activities, we're really starting to see the impact.
And Jamie, let's talk about the student population here. First off, I think it's important to note that demand for mental health services in general across the university system has increased. I was reading something that said about 35% increase, where if you contrast that to enrollment, which is 5%, we see a huge increase in demand. And now we've got COVID. What's demand like? And maybe give us some background on, are there certain types of students you're seeing that are accessing mental health care right now?
So what we're seeing, Kip, is, like you said, there's been a nationwide trend on an increase of students seeking mental health services on campuses, and COVID-19 has just supercharged that. So the demand for services this summer was huge, and we were seeing 20 more than we did last year. Last year was a record year, so we set another new record, which is great. That's what we want our students to do. But we're seeing all types of students coming in, and anxiety and depression seem to be the biggest issues that they're experiencing. So we are working diligently to serve them.
And you have, of course, freshmen that have maybe never been to school before, and now they're in a distance education environment instead of having the normal traditional introduction to school. But then you have postgrads and maybe students that are kind of getting to the end of a bachelor's degree that are very familiar with school, and now they're in this whole new environment, and potentially not even in the same city that they're going to school with. Are you seeing kind of some fallout from that?
Absolutely. I mean, if you think about it, COVID-19 from an emotional well-being perspective is like a perfect storm, because it hits like the key developmental tasks for young adults. So they're trying to form relationships, but we're also at a time where social distancing, so that becomes very challenging. They're trying to develop their sense of self, but there's all kinds of uncertainty. They're trying to become more independent, but now many students have moved back home, or living with other family members. They're trying to develop career development and competence, but now they're either lost the job, or good jobs are hard to come by, or our internships were kind of cut off there for a while. And even things just like self-care, right? It's very challenging. Gyms were closed, routines were challenged. So I think it just especially hits hard our young adults.
And Dr. Woodard, to that point, not only is, we're talking about closures here and things like gyms being closed and how it just affects your daily life, but let's talk about service delivery for mental health is a big part of that. Of course, you have to observe the same public health restrictions here. We're talking about a lot of one-on-one interaction typically when we're talking about mental health that can't happen. In addition, we've had budget cuts. We had a special legislative session that did affect your department specifically. And then the increased demand we're talking about here. How is the mental health system faring here in the state?
So we have always had a workforce shortage, and we know that we have not had the greatest access to behavioral health care in the past. That certainly hasn't changed, and the need has been exacerbated, as mentioned, by COVID. We were very fortunate that the majority of the proposed cuts in this special session were actually not actualized. So we did have a lot of that money returned back to us that was proposed to be cut. And I think a lot of that was based on the known need for those behavioral health services. We know that right now stress is ubiquitous in our culture. We have a lot of people that are experiencing high levels of stressors, to the point where in Nevada, we're seeing about 50% of individuals over the age of 18 based on a survey endorsing that they have symptoms that are consistent with depression and anxiety. We're seeing a need for those behavioral health services in our communities, and our providers have done an excellent job being able to move to telehealth. Certainly, the traditional ways of accessing care by being able to present to a hospital or a clinic have changed in the face of COVID. So a lot of our providers have moved to telehealth and even telephonic outreach. And we're also seeing people reach out in other ways. So reaching our warm lines and our crisis lines in times of need.
Let's talk more specifically then about maybe some of the warning signs here. As you mentioned, the population could be broadening here, and we might have some citizens, some Nevadans here that maybe have never accessed mental health care and really don't know what to look for, but are feeling a little uneasy with so many of these stressors we've already mentioned. Dr. Woodard, what are some of the warning signs we should be looking for?
So I think before we talk about warning signs, it's important for us to discuss that while stress is inevitable, certainly as a response to COVID, stress management is actually something that is very active that all of us can be engaging in. And so having signs and symptoms of stress at this point would be considered something that would be expected. It's when it starts to really impact your day-to-day living that we tend to become concerned. So changes in appetite or sleeping patterns, inability to engage meaningfully in work or leisure activities or relationships, feeling anxious or down or depressed for more than 2 weeks are usually good signs that it would be ideal for you to reach out for some additional assistance.
And Jamie, let's talk about managing this. You give us maybe just a couple techniques we could possibly employ here to manage this anxiety.
Well, I think one of the most important things around anxiety or sadness or depression, which many are feeling, are finding healthy ways to connect with others. Mental health resources are great and they're a godsend for those that need them. But for many people, it's just finding a way to connect with other people, family, loved ones, in your community. So anything people can do to strengthen that bond, whether it's through a local church or a club or an organization, I think ultimately helps us, manage this, because it helps us realize this is a universal experience. We're all experiencing the same thing, and it normalizes feeling this way, so we can get support from each other and realize, hey, I'm not the only one that feels this way.
And I think that's a great transition to talk about not only the crisis that we're in now, but let's move and talk about the transition from crisis to recovery. Talking to both of you before the show, we were kind of prepping here. You both said this isn't going away anytime soon. Throughout the entire recovery phase, we're going to be dealing with mental health issues, and the demand is not going to necessarily go away. In Southern Nevada here, we have some experience, of course, with trauma. October 1st, and we're coming up on the anniversary of that in just a week here of the Route 91 tragedy. Dr. Woodard, can you give us some idea of maybe the differences between trauma and recovering from something like that and something that's maybe so much of a slower burn when we're talking about a pandemic, and how the recovery phases can be so much longer here?
Sure. There are actually similarities and differences. So after any type of large-scale disaster, and pandemics, COVID being a disaster, while we do see increased stressors, difficulties managing and coping, we also do see some post-traumatic healing that can occur in increased community cohesion. We certainly saw that after 1 October, and as we're approaching the anniversary of that event, we are seeing the community again really come back together and find ways to develop meaning and community around that tragic event. The same is really happening also around COVID. So we know that after COVID hit, we had a huge surge of individuals coming forward wanting to help and volunteer, offering resources, be they financial resources or human resources. While some of that has tapered off, we do still have people in the community that are actively working day in and day out to make sure that people who are in need have access to those resources. And while we're not able to connect oftentimes in the same ways that we used to, we are seeing people find new and different ways to be able to continue to keep that sense of community and connection together.
It sounds like both of you are talking about how important community is in this. And we're talking about people that might not be trained or licensed necessarily in any type of intervention. But with that said, and let's talk about maybe some long-term strategies here. Is that potentially a strategy? I mean, we're looking at church networks, our neighbors, schools, institutions like the universities here, Jamie. There are ways to train personnel that surround the common Nevadan here to be able to provide some of these services with a certain level of clinical training. Jamie, I'm sorry.
I think absolutely. We do training on campus for faculty members. We like to train them on what to look for when students are in distress, how you can help them. We emphasize on, forming connection, helping them find resources. So just helping them find something to address their need. And whether that's coming to the counseling center or there's so many other departments that are here that form to support students. So, college students, I think, are fortunate in that universities are like a little city. There's just all the ways that we have to support and to help them connect. But I think absolutely everything we do here applies to our local community too. There's training that people can take just so they can reach out, help, support others, and increase their awareness of what the resources are for those that need them and just point them in the right direction, support them. Take them to an office if they're uncomfortable going, and just sit and wait while they're there. There's just so many ways that we can show that.
Dr. Woodard, other solutions on the table here. We're looking at that recovery could last multiple years here. What are some things we really should be looking at?
So we're looking to really build resilience in our communities, ways that we can take this as a crisis, but also as an opportunity to help communities come together and identify what resources they have naturally and which ones they can build and foster. So we have been launching psychological first aid trainings, and since April, we've actually trained 500 people statewide, and we have an additional 5 trainings that are planned for the next year. What that means is that individuals in a community without any type of clinical background, similar to the way that people volunteer for things like first aid and CPR training, can attend one of these training no cost. And it really does assist people in coming alongside people who are struggling and suffering, and gives them some tools that they can use to be supportive and help to navigate them to the resources that they need. We're also seeing existing safety nets really become incredibly pressured with the high need. And so having communities, especially with some of the CARES funding that has come through, identify what those needs are, and then trying to build and fortify those safety nets so that they can do a better job of serving the growing need. But I think collectively coming together and really examining what the impact of COVID is and has been on us as a community and as a society can help us all move together as we really try to find what we're calling this quote unquote new normal. And also work together to recognize that it's our ability to adapt and be flexible, because these circumstances are certainly always changing, and finding ways that we can support each other in that new reality.
And adaptation and flexibility is so important here. And Dr. Woodard, you talked about the telehealth portion of this being something that has been successful. I wanted to ask you, Jamie, just on the university side, I know prior we talked about how so much has been employed in that direction too. Do you see telehealth being kind of a long-term solution here within the university system for mental care and behavioral care?
Absolutely. I think telehealth and telemental health will continue to be a fantastic resource. It solves a lot of access issues for individuals. Some of the people most disproportionately impacted by COVID are those that, have to take public transportation or don't have access to other services. So I think this can really be a helpful avenue for them. So within 1 week of COVID happening and the university moving to remote classes, we had a full telehealth with secure video set up, and we've been using it extensively. We will continue to offer that service, and once we can do so safely, we'll have more in person. But I think it just gives students and people an option of how they want to access care.
Dr. Woodard, resources, what do we have available? Where should we go?
So on the Nevada Health Response website, we have a coping and managing page, which has a number of different resources that are available statewide. And I would also want people to be aware of Crisis Support Services of Nevada. They run a 24-hour hotline for anyone who feels that they are in crisis and need help immediately.
And Jamie, same at the university level at UNLV. Where can we find resources?
Well, students always can come and use the University Counseling Center and the Student Health Center. It's free for students to access. We also have resources for community members, though. We have the practice, and the Center for Individual, Couples, and Family Therapy is available. And the great thing about the campus is that when students have questions, they can just write. We have a COVID-specific web page that just lists all the resources that are available, but they can just write an email. And we will connect students with the resources that we have on campus to support them.
And within our entire higher education system, I'm assuming access to resources are very similar to that as far as the connection to the health centers.
Yes.
Great. Well, Jamie, Dr. Woodard, very much appreciate your time. Thank you so much.
Thank you.
Thank you.
Well, thank you to our panel, and always thank you for joining us for this week on Nevada Week. Now, for any of the resources we've discussed on this show, please visit our website at vegaspbs.org/Nevada-Week. You can also find us on social media at Nevada Week.